Hi friends, welcome to my YouTube channel Success Medical Mnemonics, and today in this video I will explain you about the normal MRI brain, the brain anatomy in the MRI, how to look for it. So first I will explain you the normal brain MRI so that you can differentiate the pathology by seeing abnormal MRI. So this is the brain, and as you can see, this is the frontal lobe on front. Okay, this is the frontal lobe on front, and this is the parietal lobe. This area is parietal lobe, and this behind wala area, पीछे वाला area is occipital lobe, in which there is a post superior sagittal sinus. The superior sagittal sinus like this goes to upper border of the superior border of the brain in whole length. Okay, so this is the frontal lobe. As you can see, front area is frontal lobe. This is the right portion of the brain. This is the midline, and this is the midline. This area is right side, this area is left side. This is the frontal lobe, सामने का lobe. This is the occipital lobe, पीछे का lobe. Now you can see this. First I will show you the ventricle. This is the ventricle. Okay, so this whole thing is right lateral ventricle, and this whole thing is left lateral ventricle. Okay. Okay, so now we will see this sequence. This is the frontal lobe, in which this part is insula, this part, and this is the external capsule. This area basically called basal ganglia, in which there is putamen. This is the putamen area. This area is the putamen. Inside this is the globus pallidus, and below this is the thalamus. So this whole area is basal ganglia, putamen, globus pallidus and thalamus. This is the putamen. In इसके अंदर globus pallidus, then the thalamus. Same is on the left side, putamen, globus pallidus, thalamus. Okay, this is the parietal lobe, and इसके पीछे अंदर साइड medially temporal lobe होता है. Now you can see this is the caudate. There is a head of caudate and tail of caudate. So this is the caudate lobe, caudate nucleus you can say. This is the rostrum of corpus callosum. Corpus callosum, the white fiber bridge between the two cerebral hemisphere, which connects the two cerebral hemisphere, corpus callosum. इसके दो parts होते हैं, genu and splenium. Then the sylvian fissure. This is the sylvian fissure. Anterior commissure. This is the anterior commissure, the white fiber band. This is the temporal lobe. Frontal lobe आगे, occipital lobe पीछे. This is the temporal lobe. This whole thing is temporal lobe. इसके बीच में hippocampus lobe होते हैं, and this is the internal capsule. As you can see, the fibers or tracts goes through this internal capsule, which has anterior and posterior limb. And this is the third ventricle. This is the third ventricle. पीछे fourth ventricle आ जाता है. This is the occipital horn of lateral ventricle. Okay, so we will see the another image. Okay, so you can see this is the पीछे वाला area is the cerebellum. This is the temporal lobe. This is the nasal bridge and optic area, orbits. Now this is the temporal lobe. This is the cochlea. This is the vestibular apparatus, which is related to hearing and balancing. And this is the fourth ventricle. In the previous section we saw the lateral ventricle and the third ventricle, and this is the fourth ventricle. Okay, and this is the cerebellar hemisphere, the left cerebellar hemisphere and the right cerebellar hemisphere. And this is the cerebellar vermis, which is with the related to the truncal stability, holding the truncal posture. And these are the superior and middle cerebellar peduncle. These are. Then internal auditory canal here. This is the pons. You can see this is the two vertebral arteries. Two vertebral arteries ऊपर जाकर के मिलके एक basilar artery बनाती हैं. This I will show you. Okay, so this is the basilar artery, which is being made by two vertebral arteries, जो मैंने पिछले सेक्शन में आपको दिखाया था. ये वाला हमने देख लिया. Now, okay, we see this. So this is the frontal lobe, this is the caudate nucleus, and this is the corpus callosum, and this is internal capsule. These are the lateral ventricles, and these are the anterior horn of the lateral ventricles and the posterior horn of the lateral ventricles. This is the splenium of the corpus callosum. Okay, so one is genu. This is the genu of corpus callosum, as you can see, the genu of corpus callosum, the anterior part, and पीछे splenium. Then parietal lobe, and these are the lateral ventricles. So मोटा मोटा आप देखिए, this is the frontal lobe, this is the occipital lobe. दूसरे सेक्शन में हम देखेंगे यहाँ पे टेम्पोरल लोब आएगा, एंड ये दो लेटरल वेंट्रिकल हैं. टोटल 4 वेंट्रिकल होते हैं, जिसमें ये लेटरल वेंट्रिकल हैं, बीच में एक थर्ड वेंट्रिकल होता है, फिर उसके एक्सटेंशन में एक फोर्थ वेंट्रिकल होता है. ओके, ये हमने देख लिया. ब्रेन में पीछे दो फोरामेन होते हैं. एक तो फोरामेन मैग्नम होता है जिसके थ्रू मेडुला ऑब्लोंगेटा नीचे पास होता है, एंड दो होते हैं फोरामेना लुस्का एंड फोरामेना मेजेंडाई. सो दीज आर द फोरामेना लुस्का, and this is the basilar artery formed by the 2 vertebral arteries, and inferior cerebellar peduncle, cerebellar vermis. This I explained you. Anything else? I think this much is enough in this video. Next I will explain you in another video. Thank you for watching. Please like, share and subscribe.